Our next presenter is Pon Pot. Now I've been rehearsing this, so trying to get his last name right. Jatnilafant.
Jatnilafant.
Okay, nearly. I think I'm missing a syllable there. And his supervisors, Rima Kacheta over here, and Lisa T. And Pon Pot is looking at the effect of drugs on pupil and ECG of the heart, and has been doing a lot of VR development in Unity on this particular project. And Pon Pot also had his graduation last night, so big congratulations for him.
Thank you.
Who has been doing a Bachelor of Science in, now let me get this right, specialising in industrial optimisation and data science. Thank you.
Thank you. Good morning, everyone. My name is Thonpot Jatnilafant, and the topic of my project is I hear your rhythms with the drug effect and on the pupils and ECG. So the rationale for a virtual model. So at first, we need to visualize the effects of drugs to enhance the understanding of the complex concepts. Because I have experienced this situation already during this project, the information I obtained about the effect of each drug are from my supervisors and the Australian Medicine's handbook by the AMH or the Australia Medicine's handbook. It doesn't show how the drugs affect the patient, but just telling the information what will happen when using some drugs. And so that make me a bit confused when I create this virtual model. And Australia experiments practice in the undergrad, such as physiology and pharmacology teachings are being discontinued due to the ethical problems about the usage of the animals' organs as well as their cost. And recently, people can access the internet very easily. Creating a platform for visualization is very helpful for learning. People can use the platform through internet for study. And furthermore, because of the current situation, all courses are moved into online course and not face-to-face. So this can cause the quality of teaching, as students are not able to interact with the activities in the classroom due to the social distancing rule. So to address this issue, we developed a virtual tool for observing the effect of drugs. And so in this project, there will be 3 modes of the pupils to visualize effect of light, phenolphthalein, and adrenaline. And for the adrenaline, we have to inject this drug with a syringe, so we also include the human model to show the processes as well. And some drugs can affect the heart rate and the blood pressure of the patient, so we also include the ECG monitor. So for this past 10 weeks, this is my methodology. So at first I study about the background and gather some requirements. After that, being familiar with Unity and Blender software. Blender software is the software that we use to create 3D models. So after I get the 3D models, I import the models into the Unity and then create the animations and the platform for user. Then I refining the models and the materials. After that, just create a setting to reflect the hospital environments, because we would like to mimic the hospital atmosphere and the experiment. Then after that, I just let users test the prototype and fix the get some feedback and fix the debugs. So here are the pupil modes. So the size of the human adult eyeball is approximately 24.2 millimeters and times with 23.7 millimeters. So the most left picture is the pupils when it is in the normal mode, and the middle one is the constriction mode, which you can see that the pupils getting smaller, and the dilation mode is when your pupils get bigger. So how the different drugs affect the pupils of the humans. So in this project we use we visualize only two drugs and like one material like which is light. So the first one is phylocaphine, which is like a eye drop. The effect on the eye is that the pupils will get constriction, and the effect on heart is actually the heart rate will be decreased, but like we ignore this one because it very occurs because just a single drop use it should not like achieve this one. And the second one is the adrenaline by injection. So the effect on the eyes will be like the pupil will get dilated, and the effect on the heart will the heart rate will increase, and the increased force of a contraction as well. And the light the effect on the eye, the pupil will be like constrict. Even though like you shine the light onto one side of the eyes, like if in our visualization we let the patients be like have a good health, so both of the patients pupils will like get constriction at the same time. So here's the animation of the eyedropper with the phylocaphine. So you can hear the sound of the heart rate, and like when we press the button, the eyedropper will like come over and give eye drops on the eyes, and the pupil will be constrict. And after a while, the pupils will get to the normal rate, a normal mode. And here's another side of another view of the animation to see the pupils closer. So as you can see that when the eyes drop, like get on each side, the pupils will get constrict immediately. So here's the animation of the blood pressure tracings before the injections. So when you press the blood pressure buttons, you can hear the sound of the blood pressure cuff. And on the left top corner, like you can see the ECG monitor. So after like waiting for the blood pressure to test, after the sounds, the blood pressure will appear just for a while, and then it's gone. So here's the animation of adrenaline injection with the syringe. So when we press the button, the syringe just come and like inject, and the heart rate is increasing. And after that, we try to have a blood pressure test. So you can see the graph there, the graph like getting closer because the heart rate is increasing. And here's the blood pressure like after the injection. And after a couple of seconds, the heart rate will be decreasing, and the graph will be like getting apart and not close to each other according to the heart rate. So here's another view of the injection. So the eyes will get dilation when we inject the adrenaline into the body. we try to like test the blood pressure again, but actually for this one the eyes the pupils should be dilate like for a while, like not like this, but yeah, that is the issue that we will develop it like in the future. And here is the animation of when we press the light button, the torch will like come in front of the eyes and shine the light. And you can see that the eyes, both pupils will get constrict. And after the light is like we shut down the light, the pupils come back to the normal mode. And here is another view of the lightning animation. So for this animation, I have to say special thanks to Kari because she showed me like how the pupils work when like get in touch with their light. And this is the opening scenes of our platform. So it is inspired by computer games because like when we enter the games, there is a menu for the user to choose. So this one we can choose like you can choose an option like male, female, or we can quit the platform. And here's the user interface. So I create a hide button for user like to hide all the controllers. So it's not like it's not annoying, like so user can like see the atmospheres around the patient easier. And actually we can like move the camera around by using the arrow on the keyboard or the WASD. And on the top left corner ECG screen button is like when we press it, it will like show the ECG monitor, but after we press it again it will disappear. As well as the instructions button, so if we press it, it shows how the step how to use this platform. And on the eyes colors down there, it's like green, blue, and black. It is the color of the eyes. We can actually change 3 colors of the eyes. So for the future development and adrenaline buttons must be changed because right now, as you can see, that is quite small and really hard to see it. So that will be fixed like in the future. And the heart rate of ECG monitor must be changed as well because like the sound is like not according to the ECG monitor, the heart rate. And the duration of each drug must be restricted to the reality, like as I show in the philosophy in the injection. And yeah, in the future we will add more drugs and information in the ECG monitor, such as the oxygen rate. Yeah. And for the future application, the virtual scenario used as part of an array of an immersive learning experience. And secondly, the development of the other scenarios for different medications. And the final one is to create virtual patients with different disease states, because right now the patients are the patient is like has a good health. There is no disease in the patient. So acknowledgement, I have to say special thanks to Dr. Rima Kaketa, Professor Lisa P, and for supervising me, and thanks Kari Teles for helping me with the Unity, as well as James Alex. And I have to special thanks to faculty of the health science as well. Thank you.